I first heard about Docs for Patient Care the last Saturday of August. It was a beautiful sunny afternoon in Atlanta, and I was in my car out running errands when I heard a short announcement on the radio about the organization and its purpose. I hurriedly jotted the website information down on a piece of paper. However, I managed to misplace the paper with the information on it. That following Wednesday morning, September 2nd, while at home doing some housework, I came across the paper misplaced and excitedly pulled up the Docs for Patient Care website on my computer. I saw a familiar face and name on the website, that of Dr. Hal Shears. I listened to the message he shared, reviewed all the pages on the website, fully agreeing with what was being stated. I saw the call to come to Washington, and I remember thinking to myself, can you do that? Can you just up and cancel your Thursday patients and fly out to Washington to meet with congressmen and senators and be involved in a rally in which you have the opportunity to share your feelings on health care reform? I quickly came to the serious conclusion that the stakes were just too high for me not to make that commitment to get involved. I agree with Dr. Shears that it has not been to our best interest as physicians to be silent on this matter of health care reform. I have held very strong beliefs opposing so much in this proposed bill. Other physicians who are my friends and colleagues also expressed deep concerns and reservations about the proposals. Our murmuring and complaining has largely been among ourselves. We have felt unrepresented, faceless, and voiceless, without a forum for expressing our deep concerns and reservations until now. We as physicians greatly desire much needed health care reform. However, we are standing here together to proclaim that we as practicing physicians must have an active role in achieving that health care reform. I equate trying to establish health care reform without the active, meaningful input of physicians is like trying to build a massive bridge without engineers, just a group of well-meaning individuals drawing up the plans. Can you attempt to do it? Yes. But is it legal? Is it ethical? Is it the means by which you have the potential to attain the best possible outcome? No! I think not. To get the best possible outcome, I contend you must have all parties who have a deep vested interest in that outcome intricately involved from the beginning in your decision-making process. As far as health care reform, we as physicians are like that engineer analogy, completely shut out of the planning and building of that massive bridge. Good analogy. Our voices have not been heard. Our faces have not been seen. And yet so very much is at stake. Our patients need to know implicitly that we are their best advocates, enduring grueling hours of internships and residency programs, as well as long hours working in our practices, hospitals, and clinics. We have done the time. Most of us are honest, ethical physicians who seek to provide the best medical care that we can to the patients who are entrusted into our care. We are not the enemy. Right. Patients, know that we will cover your backs if you don't tie our hands behind our backs. If you believe that some faceless person out there under the auspices of the United States government needs to control every aspect of your health care decisions, including what type health plans will be available for you and your family, what health services and treatment modalities you will be permitted to receive, implementing higher income taxes for American small businesses, penalties on individuals without health care coverage, or who choose not to purchase the government-approved health coverage, penalties on employers who cannot afford to provide the government-approved health coverage, as well as requiring the taxpayers to fund abortion on demand. If you truly believe that our government needs that much control, then you need to support the current health care reform bill as it currently stands. However, if you believe that you have the fundamental right and responsibility to be fully informed by the doctor you've selected, the full gamut of the treatment modalities available to you, and that you and your doctor and family have the right to determine the extent of the care you receive, rather than a federal health board overseeing what treatments you will be permitted to receive. If you believe these fundamental rights belong to you and you alone, then you need to stand with us. That's right! Let us together stand up for responsible health care reform that is honoring to our profession and equally honoring to the patients who are entrusted in our care and in whom we seek to serve. Good work!